Uzma, welcome back to moneyHOP Q&A session. It's nice to have you here one more time. So today, we are talking about the healthcare industry abroad. When we dig into the history of immigration, it goes back to the First World War. There were Indian nurses who served in the Austro-German Empire during the First World War, and it's something that still continues even now. Students are keen to go there. A lot of students who are in plus 2 10th and all, they want to go abroad. That's the final destination, Europe, mainly Europe.
Yes.
So how is this overall trend going on? Which are the most trending countries that students choose to go abroad? I know UK and I know Saudi, UAE, but have the trend changed recently? What about Europe? Can you give us some pointers on that?
Absolutely, yes. First of all, thank you so much. Happy to be back here again and sharing few informations. I'm sure this is going to be helpful to you all, whoever is looking as a healthcare professionals to be migrating to Germany as a destination. And today we're going to talk specifically about Germany. And like you mentioned, yes, there is a very high demand in terms of healthcare professionals. I would say almost in all countries, not just Germany as a destination, but there are few qualities or factors which outstand with other countries and making Germany as the number one country or for you to choose or go into the country. I will definitely talk about it. Now, what is the kind of professionals or healthcare professionals who are high in demand as of now is RNs, very pretty much in number one place is registered nurses. We have doctors in requirements, physiotherapists, lab techniques, medical lab techs, dentists, and healthcare assistants and caregivers. Now, these are some of the professions which is very high in demand in Germany as a destination. And like you mentioned about UK, Saudi, or UAE as a country also where people are migrating to or looking to settle down. But there are few aspects or benefits like Germany. One is number one is competitive salary. Very good benefits of your salary package is absolutely going to be there. In terms of economy, it is very important factor to see what next after you come into the country. Are you going to stay there for a longer period of time? Are you going to get a PR, permanent residentialship, if required to be in the country? Is that easy? In Germany, I would say absolutely yes, possible for you to be getting a PR, staying for about 5 years in the country. And very important factor is that you get a family or a spouse visa or a dependent visa. So you definitely can bring in your dependent to the country once you start working in the country. You can bring in your kids, your family, and another big factor is that you have a family and kid, and their education is going to be absolutely free. There's no going to be education fee factor, which is very good. And there is going to be great benefits in terms of say your health insurances, or for you to be in the country in terms of your living costs. There's always technology and new inventions which is going on in the country and shortage of skilled laborers. Especially these professions are high in demand because of the aging population in the country, and the number of population in the country is pretty low, and they need skilled workers to be going to the country. So this is few things that I can speak about that you choose as a healthcare profession going to Germany.
Coming to the second question, what are the qualifications or the prerequisites for going to Germany?
Yes.
This has to be talked in two perspectives. One is a student who has completed their healthcare course, say MBBS, and they wants to go abroad. So what are the prerequisites for that? And secondly, the students who are already experienced or who already work here in India and they want to go abroad. So can you talk in both the perspectives for our audience?
Absolutely. Now, somebody who has to go as an RN, for example, to Germany, you need to meet specific qualification. like BSc in nursing, it is a must, or GNM certificate is accepted for you to get placed as a physiotherapist, bachelor's degree in physiotherapy with the registration certificate in your country. Or like the other factor, even you mentioned about 10th, 12th, even after your 12th, for you to go study, there is something called as Ausbildung program, which is a short term or a short duration of course, which allows you to go into the country to study for about 6 months to a year of duration, and you absolutely start working right after that, and you also get paid while you're doing these kind of programs. This is one thing that is very much required in terms of your degree. It is bachelor's degree that you have to understand is a requirement. And second thing is you need licensing for you to go to the country. Very important. This is also called as Anerkennung. It's a German word. It's a licensing process. Nothing but it is a qualification recognition process that your basic degree of India is equivalent and recognized in Germany for you to start working as a licensed nurse. So there is a documentation process that happens through a relevant authority. It varies by profession and it happens through a federal state in the country. This is a licensing process. And the most important aspect is that you need German language certificate. It is must for you to have a certificate of a language fluency, which is about B2 level. It used to be about B1 level, but now it is about B2 level. Somebody as doctors who's looking to get placed in the country, you will definitely need about C1 level of German language. These are some of the documents which is important and factors to look at when you're applying.
So you talked about licensing, getting the license. So which body gives that license in India? Where are the centers? So can you explain about that? Because the audience who wants to like go abroad to Germany can right away search it and they can start the process.
Absolutely. Now, this licensing does not happen through India. Like I mentioned, it happens through the federal state in the country, like in Germany, it can be in Berlin or other states in the country. Now, basically, this document initial stage is a translation of your education background, which is like your BSc degree with a degree certificate and transcripts, and your midwife council certificate has to be translated. This translation can happen from India or from Germany, and the translation is through a recognized authorized body where they translate your marks and whatever is your university's information to German understanding transcripts or the document, and then it is applied to the federal state for your licensing, that this particular candidate is efficient and equally recognized in terms of education. If you have work experience, that will be added to for the translation, because it can be an add-on. Very important factor for you to know is that you don't need work experience in terms of any profession initially when you're applying. You can absolutely go with no experience, and if you have work experience, it's a plus point. This is one of the processing that takes place. Your education qualification, which is in India, cannot be understood by the German government or an employer. That's why this translation happens, and then the licensing happens. How do you know is you can research through licensing authority of the particular targeted country. And how do you overcome, or how do you do this process is start pretty early. Bare minimum of 3 months of duration is a must or a requirement for you to just to do the licensing and translation process. Most important, I would say, seek guidance from professionals, organizations, or recruiters specializing in international placements. Because it is going to be only about 3 or 4 stages of your processing, that is your licensing and the work employer interview process, work contract, and visa. The other part of the processing is just going to be in terms of documentation. Very important thing to know for you or to go to country is work on your communication skills for German language.
So this certificate, like this process, all healthcare professionals has to do, or it's just for nurses and doctors? Every professional should do
All
this.
every professional who are applying to the country has to go through this process of translation and licensing. It is a must.
So you told that like Germany is one of the most trending destinations now. So a lot of students would be going there. So the competition obviously increases. So how can we get placed better? Can you give some career tips for the students
Yes.
who's there already pursuing their course?
Absolutely, yes. Um, Competition is there, but when we speak about Germany as a country, in terms of healthcare professionals and in terms of advancement in technology and the healthcare systems, which is growing year on year basis, and the requirements also are growing equally year on year basis. So you do not worry about getting placed if you're in the right hands with the right organization who does placements. You're definitely going to get placed, and it's going to be no difficulty at all. Now, what are the challenges, or how do you apply, or how do you process? I will speak about the challenges. Is that I said licensing. Now, as an individual, you may not be able to take care of your licensing by yourself. Seek through an assistant or a guided counselor or a consultant. And in terms of your language proficiency, you might have found an employer and applying to an employer without adequate language proficiency, like you have even A2 levels, and you thought, yeah, let's go ahead and apply. Don't do that. And in terms of understanding the salary criteria or your expectations, don't have an unrealistic expectations or a work contract. Understand what is the kind of a payout in the country. Say, example, we spoke about RNs or a physiotherapist. Like a registered nurses on a yearly basis, you get paid around 35,000 to 45,000 euro a year, and as a pharmacist you get around 50,000 to 70,000 a year. Doctors, you get paid around 65,000 to 90,000 a year. This differs and depends on the professions or people with experiences who are going. It can increase once you are a fully licensed uh, nurse or any kind of another professional that you're getting placed in the country. Your payout is going to go higher, and it will definitely take care of your living as well as your savings, very high comparatively to the standards of the industry that you're currently in or in the country you're working for.
Yeah, you told about language, the importance of German language for
Yes,
healthcare jobs. Um, you also told that like if you are going for MBBS role, a doctor role, definitely you need the language. So can you break it down the process, how the language proficiency is being measured into a bit
absolutely.
more detail? Let's go from the technicians who are applying to the pharmacists. So there are different layers of healthcare profession out there, right? So can you
Yes.
keep all these perspectives in mind and break down the language thing for us?
Absolutely. Um, there is no kind of a compromisation on language skills whatsoever. It starts with B2 or C1 level of certification, which is a must. Say example, strong German skills are very essential. First factor of your processing after you get your license is that you speak to an employer. There is going to be a interview process. So this is going to be online, absolutely like this on a Zoom meeting or a Teams meeting. This is going to be an online platform. When you're speaking to an employer, it is absolutely going to take place in German language. The important factor they're going to look into is how good is your communication skills, and you're able to understand them and talk terminologies, use the words, which is very important because once you get into the country, you're going to have a communication factor with the population of the country, or you get into a healthcare sector. You're going to talk to your patients, or you're going to talk to your colleagues. You're going to do interactions, which is absolute going to be in German language. It is important for you to know and understand if you have to do some kind of a documentation work. All these will require a German language skills. Even in terms of your licensing exam, there is going to be a licensing exam that you're going to take up once you're in the country, not before you enter the country. It can be after you be in the country about 6 months or a year of time after you're well prepared for the examination. Basically, this is going to be in German language as well. So, so these are the aspects and factors where language is going to be involved. Even if you're in a home country working into different states, the kind of communication with that kind of people surrounding you or population is going to be different, and you make that effort to learn the language for a better communication. It is simply like that. For you to understand German, it is very important. How can you learn, and what are the ways to overcome this language barrier? Honestly, if you are good and fluent in English, it's going to be absolutely easy for you to learn German language. For you to be as a beginning or a beginner level, you have lot of online platforms for you to do learnings, or apps like Duolingo, Babbel. As a basic initial learning, you can use them, but I definitely suggest you to register yourself into a class, a classroom environment. It can be online class or it can be a physical face-to-face class, because you're going to do communication in the classroom. You're going to play games, remember words, you're going to do assignments, take notes. These are some important factors for you to remember and understand the language rather than just doing an online learning. So it's important for you to, practice on a day-to-day basis. Take up mock sessions and try to listen to German podcasts, medical related journals. Do most of listening into medical related whatever is the TV shows that runs, because they are going to use those equipments or terminologies which is very easy for you to understand and capture the language. It will be very helpful and easy for you in terms of pronunciations. How do you speak, and also please put it in practice on a day to day basis. Try speaking to your classmates, or try talking to yourself in the mirror. Try talking to your friends, colleagues, even if they don't understand, but you practice, so it's going to be helpful.
So you are the founder of ESC Europro, and thousands of students go to Germany through your consult brand every year. So what are the common mistakes you see students generally making when they are applying
Yes.
for career abroad, for their healthcare career? Like, what are the common mistakes that makes them unattractive to the employer in Germany?
Yes, very good and important question, and you should all know out there. When you're applying, don't apply with the incomplete or an incorrect qualification recognition. Incomplete qualification is that you have a diploma degree which may not be accepted. Don't do that mistake. Understand what is an absolute requirement. May not be master's, but like I said, BSc degree is a must, or JNM certified is a must. And incorrect qualification recognition process, like I said, it has to go through an authorized body or an organization for a recognition process or a licensing process, which is very important for you to understand. You may apply with the incomplete language proficiency. Don't do that. When you're an A2 level, you start talking to employers or applying to employers. Don't do that. Try learning at least B1 level, B2, and tell them that you're going to complete B2 or C1 level post or later, which you're going to do. Um, a very important aspect is making mistakes on your CVs or your cover letters. Now, in terms of CV, I have already spoken, and I still say adapt yourself to Europa's CV format, which is an format which is absolutely required for you to follow when applying to employers in Germany. Highlight your clinical experiences if you have any, licensing examinations that you have passed, and language skills that you carry. Please highlight these rather than writing about hobbies. I listen to this, and I do that. Good to give most precise info. In terms of cover letter, keep your cover letter concise, formal, and to the employer. It is very important for you to write a cover letter according to the employer, because you are going to get the employer info in terms of the location, what kind of designation you're going to get, and work kind of what is going to be involved, and you have to write according to them. Don't keep it generic, which is another mistake that people try to do. It can be small, but very important for you to ensure that you take care of these. And most important, I say, is that interview process. When you have an organization or an interview process with the employer, like I said, they have all the infos given to you beforehand. When you before start your interview process, ensure that you take that period of time, about half an hour's time or 1 hour of time for the interview process. You make yourself free, be in a noise free environment, which is very important. I have seen candidates doing interviews on roadsides with cafeterias, kind of a place which is very noisy, and it may not help you much in the employer understanding you, and with your different language efficiency, it's going to be tough. And always ensure that your informants or your work clothes is absolutely fine with the bag of a white background, and be seated on a chair, not sitting down on the ground, which is very important. Speak to them confidently and ask them to repeat the question if you don't understand. It is absolutely okay than you giving a different answer to a question which can lead to rejection. So it's always okay for you to ask them to repeat questions, understand, and then try to answer back. Very important, because once you pass this interview, all is going to be left is your work contract. Within a week or two time, you're going to get a visa. You apply for visa, and Germany as a destination for a work visa, there is no rejection happening or happened so far whatsoever. So high percentage of visa acceptance is there, because you already have all the qualification and requirements that you're meeting. These are things that you have to remember before you apply to your employers.
So moving on to the last part of our conversation, can we talk about the financial aspects? Like once a professional joins over there, what are the cost of living over there? How much they can save? How they should manage the expenses overall? So can you share some insights based on that?
Absolutely, yes. Also, an important point to note or understand before you relocate to an international destination completely. Like earlier, I gave you an expectation of salaries by professions, like a registered nurse, around 35 to 45,000 a year, which means per month, your initial salary would start somewhere between 2,300 to 2,700 euros. As an initial nurse, when you start working, once you're a fully licensed nurse, you will start earning around 3,300 to 4,000 euros. It can depend on your experience and expertise. Now, what is the kind of a cost of living? If you are earning around 2,200 euros, what are the expenses that you're going to bear when you're in the country? Is going to be based on your rent. The accommodations that you're staying can vary between cities. Big cities like Berlin or Munich can have a higher cost of rating in terms of rentals comparatively to small cities. It can vary between 400 to 500, and higher cities can go up to 600 to 800 euros. It depends. Some employers can as well take care of your accommodations or take care of your part payment of rents, which is absolutely available in work contract. Always check with employers. No harm in it. The other kind of expenditures that you expect is about your utilities and internet, which can cost hardly around 100 to 150 euros a month. Groceries about 150 euros a month, and about transportation about 60 euros. So overall, 1 month expenditure would be around 900 to 1,000 euros a year. and for a month, and you're earning 2,200 or 300 euros, which is a big savings of about 1,000 to 1,300 euros, is about a lakh in Indian rupees. As a nurse who's working in the country or in India, when you start as an intern or a very much as a pretty new nurse who start working in hospitals, your salaries may vary between 10 to 15,000, or per year can be about 1.5 lakhs to 2.5 lakhs. This is your LPA, that is your entire cost of what you're earning. When you see Germany as a country, your per month salary is going to be between 2 lakhs to 3 lakhs, and you're saving about 1 lakh per month. And when you compare it to a year, it is like, at least 10 or 100 times higher than what you're earning here. So, very good factor is that you're going to have salary benefits and also other benefits like your health insurance coverage by your employer can be one good factor. Your relocation expenditures, absolutely, you will have expenditures. And what are the costs that can involve is your licensing cost that can be involved, and it varies from organizations to organization. I don't have a specific number as such for it. There can be expenditure about visa fee for a visa interview process. There can be expenditure for your flight costs, and some employers can take care of your flight costs as well. And the initial accommodations can be taken care. But to say overall, what is an expectation that you can have is around 1,500 euros to 2,500 euros. This can be something that you expect as an expenditure for you to be licensed and to relocate and settle down in the country. This could be the costings that could be coming around.
Lot of incredible insights as always. Many people have watched the first conversation with us, but still there will be a lot of people who are watching this video for the first time. For them, can you tell a little bit about yourself, about your brand, so that they can reach out to you?
Absolutely. Thank you so much. So ESC is a consultancy for your education and immigration purpose. Now you're somebody who's into healthcare and looking to get placed as a dentist or pharmacist or nurses. We do your licensing and relocation process. And for students who are looking to study for your higher studies in Germany or any other countries as such for bachelor's or masters, we help you out with it. This is about the organization, but talking about myself, that I've been helping out international students into thousands of numbers since about 2013 to now, and place students to various countries in terms of universities, top universities to the USA, to Germany and UK and Australia as a process. We have successfully got university admissions and visas and placements post there in the countries. If you have to know any kind of a information or a processing knowledge, there is always us, and you can reach out to us at any point of time. And thank you, Vishnu, for this wonderful time. And we wish to see more and more people joining in. And if you need more of info, do contact them. And we are always happy to give out any kind of infos you need.
Thanks a lot, Uzma. Thanks a lot. It was a very good session.